there's Cindy.
The same thing. I'm ready.
Okay.
All I need is you to set up where I'm what videos to play.
We just have that one.
Oh, I got the internet working. That's all I got right there.
Okay. Joe, can you hear me? Joe Leatherwood?
Yes, ma'am, I'm here.
Okay. Are you our secretary tonight? It has you listed.
Correct.
Okay. All right. Wonderful. Thank you. Dan, while we're still letting people come on board, I have a question for you. I saw that you're on the State Affairs Committee. Can you hear me?
Hello?
Hi, Dan. I saw
I'm
that you're
Mr. State Affairs.
You're Mr. State Affairs, so
I'm in charge of State Affairs.
You are the person to speak to. So we have a plank that deals with veterans' medical freedom. So is the State Affairs Committee taking in the veteran resolutions?
Not that I know of.
For the record,
you guys, if you want to watch the stream itself, just go to the committees
exactly who would be dealing
page
with the veterans issues.
and click on any of these right here. These are going from 6 to 8.
I don't know. What I'm
And
going
then
to
these
do
will go
is
from
I
8
have
to
about
10.
100
So I'm in Health
on
and
the
Human
bottom of my
Services.
list that belong elsewhere. So what I was going to do is sort those out over the weekend, try and figure out which committee chair to send those to.
Okay. All right.
If you don't know, you could blast it to everybody.
Just send it out to all the committee chairs?
Yeah, that's what I would do. That's what I plan on doing. Unless it's obvious that it belongs somewhere else, then you can send it to that one person.
Okay. If you find out who's managing most of the veterans issues, because we actually sent several veteran-related resolutions in.
Let me take a quick look. What did I do with the platform? There's nothing in the platform right now that says anything about that.
No. And sometimes they're under multiple different categories depending on what the subject is. So I was just going to reach out to you first.
Okay. If you got anything else, I'm looking at the platform now. Let me see what it says here.
All right. It's a little after 6, so, and we do have a quorum present. So if it's okay with you all, we can go ahead and get started. I was looking through and trying to kind of shade and mark out all the resolutions that had to deal with medical freedom that we had addressed last night. And there were a couple of repeated themes that I saw that I was going to present to you all and have you comment and let me know what you think. There were several resolutions that dealt specifically with banning mRNA vaccines. And I don't think our medical freedom resolution specifically talked about the mRNA vaccines.
So what are you on those? I refuse to take any of them anymore. You're the medical expert. What do you think?
Well, it does integrate with your own DNA. You know, it's a messenger RNA segments. That's what they included in the vaccine. And to be honest with you, I don't know why they did that. And that's where the aborted tissue comes in. That's where they extracted DNA from the aborted male tissues and integrated it into this vaccine. And your body has an enzyme called reverse transcriptase that turns a RNA into DNA. And so messenger RNA, through that transcriptase process, can actually integrate into your own DNA. And I've heard that messenger RNA was actually shutting down some genes in your body that protect you against cancer. And that may be why you're going to start seeing young people in their 40s developing cancer. I doubt they'll draw a direct correlation to that, but there's some speculation that is a result of the messenger RNA vaccines. So in my mind, I do not want to take a vaccine with messenger RNA in it, and I don't know that it was specifically beneficial. You know, the COVID-19 vaccine is not truly a vaccine. So, I'm not sure what the plan was, with all that. You know, all of this was developed as a bioweapon, initially. I mean, that's what the theory is. So, Cindy, do you have anything to add regarding that? You'll need to unmute.
No, excuse me. I'm sorry, I didn't hear what you said.
I was asking Cindy to unmute.
And I'm having some trouble with my connection as well. So let me know if you can't hear me. No, I think we should include everything. And since there are people,
we're in the annex, so go through those doors and the next doors, and that's where the meeting room is. Okay, I'm sorry, Cindy.
That's okay. Because I've also had people separately send me stuff that say we should say, vaccine and edible vaccines and, other, or vaccines that, what is that called? Like that they give to animal herds sometimes that move throughout the herd, because they give it to some. And
the herd immunity, that's.
No, not that. There are some newer vaccines that you give it to one person and they go home and they share it in from their body with other people. Transmutable? Is it transmutable?
Yeah, because there was. Hi, Ben. Thanks for coming. Hi. I'm on a meeting. Yeah, but we have Ben Armenta here tonight and George Abraham, and we have 3 of the vice chair candidates. But people were shedding the spike proteins.
Yeah, they were.
From the vaccine. And, I think, in all honesty, I felt the vaccine was acting more like a bioweapon than a vaccine, to be truly honest. So, I don't know if we should add another special subcategory to specifically state that, we want all messenger RNA vaccines banned. There were a couple of resolutions. I don't know if you can bring up the working document. But
is it possible that we can look at the working? I work on 2 screens here. That we can look at the working document. Where I couldn't find it in what I got sent last night. Do I have it somewhere and I'm just not finding it? The current version.
I think there were 2 attachments that Rick sent out. Okay, there was the complete attachment that had every resolution in it, and then I think the other one was our updated working version, and it didn't contain all the resolutions.
Got it. Okay.
Yeah.
Got it. So I have to.
Yeah, it just kind of contained what we had most recently worked on.
I'm going to bring that up here just a second. Sorry.
Okay, and Rick, is that coming from a different email, not your personal? Because I have your personal. Is it?
Oh yeah, it's one it's called RPT editors or something like that.
They're well.
Dang it.
Yeah, 2024 RPT.
That's it. And it looks like screen sharing is disabled for the host. I guess your host has to enable it. And I think you have to do that by making everyone a co-host who is on your committee, or you want to be able to share your screen. Share the screen.
Yeah.
Well, we can. Yeah. Melinda, if you want to make me a co-host, I can.
JR, can you help? It's not giving me an option to work as a host. I can't make anybody a co-host, and
I heard that there was a problem with that last night as well.
Dan,
let me text and see if I can get an answer.
As the host, so you should have permissions, Dan.
Yeah, it said the host disabled participant screen sharing, so I don't know who our host is.
Dan is.
Oh, Dan is?
Yep. Can you hear us, Dan?
Excuse me? I'm sorry.
Dan, I don't know if it's because you joined first, but you're currently the host. You'll have to grant permissions to Melinda or myself.
All right,
So
let me do this. A co-host, yes. I must have got in before her, so it made me the host.
Okay. I'm just going to enable it. All right, try it now, Joe.
And I'm happy for you to remain host, Dan.
I took charge.
I appreciate it.
Okay, how many of these people on here? I don't know, or who on the committee? I think Melinda, I made you a co-host, so you should be able to make the rest of the committee co-host.
Okay, let's see.
So I see Mr. Rick again, the guy that looks 63, that's 71.
You're too kind. Yeah,
Let's
I'm
see.
just the backup.
Yeah, I'm not coming up with any options for that. Cindy is a co-host,
Yeah.
So just tell me, is Marga one of them?
and Marga's a co-host, and JR.
Okay. How about
And-
Amy?
Amy is a guest. We have a lot of guests on tonight.
Go figure. People
So
finally
there's
know
just
about it.
5 of us that are on the committee tonight.
Okay, I'm going to make the secretary also co-host. Okay, let me know if I'm missing anybody. Oh, Michelle is definitely one. I'm missing her.
Is she on?
Michelle's on.
Okay, good.
She's probably.
There you go. So now I made Michelle co-host.
Okay, great.
She's probably ducked out of her daughter's award ceremony just to meet with us.
Okay, let me know if anybody else I missed needs to present. So everybody's unmuted, whether they're a
Yeah.
co-host or not. So hopefully the people who are not members won't speak.
Yeah,
So we'll
all
leave it at
all
that.
the guests will stay muted.
Well, and that,
Okay.
just to be clear, Melinda, you're not just referring to non-delegates. You're saying anyone that's not a committee member should remain muted tonight.
Yeah, only the subcommittee members can speak and interact with one another, and they're listening. They're on an observation mode.
Will we be doing public testimony or delegate testimony in subcommittees? Because education, Kerry announced that he's going to start taking public testimony tonight's committee. I don't know if that
No,
was-
we're not set to take public testimony, I don't think, until next week.
Yeah, Monday and Tuesday is scheduled for the public testimony.
Yeah, that's my understanding too. I'm just, I think delegates are getting mixed messages. But I'll let them know.
Okay, Rick, can you enlarge that working document?
Is that better?
Yeah, a little bit more.
Okay.
And can we center it on the screen a little better?
I thought it. Let me stop share and start again. I thought it would remain shared if I resized it, but maybe not.
Here we go.
How's that work?
Yeah,
Perfect.
that's great. That's
Okay.
great. All right, so we'll scroll down to 137. And this should show the amendments and changes that we made. We may have passed it up. It was the big yellow one area.
There we go.
Yeah, there it is. There were lots of resolutions regarding vaccine issues, and I have a copy that I have shaded all those a light gray color just to show which ones we've addressed. So we make sure we address all of our resolutions. But if you'll scroll on down a little bit, I think not too far from this area, there's a couple of resolutions that are in that medical tyranny. We have referred that to the criminal affairs committee. We can scoot it on down. Yeah, we put
Oh, I
that
see.
down.
Yeah. Okay.
Yeah.
Yep.
So
Okay.
okay. And then okay, perfect. Yeah, scroll on through there.
Okay.
Because we just took changes out of that one. Yeah, keep on going down a little bit. There were many resolutions. Okay, here it is. It's from Calhoun SD 18. Any plant or animal meant for conception that contains mRNA vaccine shall be labeled to indicate. They wanted labeling that showed that there was messenger RNA in the vaccine. But I think there's another resolution that requests it be totally eliminated. So we can screen down.
Maybe I should search for RNA.
Yeah.
Do we
How about this
have
one?
a plank
Okay.
on?
Yeah, this is the one, no experimental injections. It prohibits the sale and distribution of experimental genetic treatment injections, all messenger RNA injections in Texas. The Attorney General is to call immediate cease of all COVID-19 injections. So I just wanted to address this issue before we move on and leave medical freedom. Michelle, do you have any comments regarding this issue?
Well, I think.
So do you think that would be a separate item we would need to add if we want to add it?
She said about labeling, big fan, for labeling. We could say until mRNA vaccines are outlawed, we insist they be labeled, something like that. So we're outlawed.
I like both ideas in this plank, but it almost seems like there should be a broader plank on like labeling so the public knows, not just mRNA, right? Just we already have some of this, but it just goes on. It's just more about the public's right to know, right? And then also one calling for the ban of injections as well.
Yeah, that's what.
Yeah, there's another one from SD11, Harris County, talking about prohibiting the messenger RNA injections.
Let's put that here in this one, and then I like the idea of putting the labeling because there is so much that needs labeling.
And are you to want reference to 137 at the same time? Is that what we're doing here?
Mm-hmm. That we're considering another subcategory within 137 that would address this issue.
Okay. All right.
Because I don't know if we really had one addressing labeling.
So Cal, who submitted one specifically on that? It's the 18. But yeah, I don't know if there's one in existence. A lot of labels on medication.
Now Michelle made a comment that she would not put these under 137. Is that correct?
Yep.
Well, it kind of fits with informed consent.
Right.
Because the labeling provides informed consent
Like right to know.
and right to know.
That's what I was thinking too.
So informed consent comes up in 141, 154, and 169.
Yeah, and we're going to address those tonight. So you want to just put this on hold for now? And the other thing that came up a couple of times is that they wanted to introduce the medical freedom into the Texas Bill of Rights. That was mentioned a couple of times in some resolutions. How do you all feel about that?
I think it's good to put, our true rights that we should already have into our Constitution. Very hard to undo. Like there's always just the caution to not forget anything or leave it, leave it broad enough, like just plain we make our own medical decisions for our own bodies and our family or our children.
Michelle's saying, didn't we already address this in 137?
Well, it's in the opening statement. So, technically, it's already been addressed. That we're calling basically all of these subcategories to be added into the Texas Bill of Rights.
What number, where is that? An actual, you wouldn't call it adding to the Bill of Rights, you would just call it adding to the constitutional amendment.
Right.
To the Texas Bill of Rights. I see. In addition to the Texas Bill of Rights, we would, I think, more properly say, we're calling for a constitutional amendment that explicitly states.
An amendment to the Texas Bill of Rights?
They're just generally referred to as constitutional amendments. They're what we vote on in November.
Uh-huh.
and everything that gets on there passes, even when it shouldn't. But
that's true.
Or almost everything, yeah.
All right.
But,
so are you all happy with our current wordage?
Yes.
Okay. All right. We'll leave that, and then let's start moving on to our next planks.
No. Okay, so we're leaving C in. I want to make sure, are we leaving C? That's the one.
Oh, yeah.
Everybody wanted to move. I did some work on where we could move it if y'all still wanted to move it.
I sent an email earlier today with various links where this is addressed that they can be.
Oh, okay. I don't think we should delete it completely because all of the other ones are talking about the actual procedures. They're talking about, they're talking about different things. So we could put it in 183, and I thought I have another one here where we could put it. Or we could add it to the bottom with some other language. I got interrupted 80,000 times today when I was trying to work on this. Let me see if I have another note.
All right.
So where do you want to go next? I'm sorry.
We'll go to 138 next.
Okay.
Sorry, guys, I've been getting a poor wireless
it'll be
connection,
a big
so.
yellow. And I didn't really see many resolutions addressing changes to this plank. The only thing I like to do on this plank is write out Texas Medical Board instead of TMB, because not everybody knows. Well, it's kind of it kind of tells you what it is up there as the abbreviation. So I guess you can leave it, but
Well, it does. I think it has it. Is it someplace else? Well, see, it explains it here and then puts it here. Do you want to spell it out here as well?
yeah, it's mentioned a couple of times below.
Like the
Any medical malpractice issues brought against one of their physicians, it goes before an administrative board. And they decide if it meets the standard of medical malpractice. So, that's just the current laws right now. But if we don't have any problem with that, we can move on to the next one.
good.
So, does everyone agree to go ahead and approve 138 as is?
Yes.
Looks good.
Okay. All right. Now let's go to 139, manufacturing our own medical products and supplies in the United States. I mean, that makes no sense.
I agree with the spirit of it. I'm just like, what is that? What kind of law is that? Like, maybe it's the promotion or education. And certainly we want, if there's government agencies buying drugs, they should be, like, I think you can write a law that would state, purchasing only medications made in the U.S. It just seems like a broad statement, but does it really have any teeth to do something?
Well, I know the intention of this one. The intention was that since many of our drugs and almost all of our generics are made in China, that they could at any point stop sending them to us, say that we're not going to send our drugs to the United States, the drugs that are made here, and we would have no drugs here. So it's more of a statement, that our state this is probably an industry that our state, generally we say leave, don't get involved, but maybe we ought to be involved in helping actual producers of some of the things, like even I know we don't all use a lot of medicine, but like insulin, you have to have.
Maybe it's something like some kind of, not a committee, but like a study to be done to see the risk that we're at, right? To be able to expose, hey, you realize if we stop receiving drugs from China, literally this many millions of people will be, at risk.
Well, we've already seen the risk in medical care recently. I mean, there was a Ritalin shortage.
Yeah.
And a lot of people couldn't get their medications. There was a penicillin shortage. There's no excuse that America, doesn't have access to pharmaceuticals. Especially those companies are making billions of dollars.
Insulin is the big one to think about. People would die in months, without insulin.
Oh yeah.
People need it. That's one of the big ones.
That's what I'm saying. Like in the spirit of the plank, though, like seems like what would be effective in helping achieve this is to have like a number that stated, hey, if we shut down or stop receiving drugs internationally, 30 million people would be at risk of dying from, not having enough insulin.
I think
about striking the language. I'm just more about like what is from the nature of what a plank is. I think we're calling for a value and some kind of law to come off of it. So what is this really calling for?
Well, I think the strong message here is that we're encouraging our state to promote private entities to initiate, sustain, the buildup of medical supplies and pharmaceuticals. I think we should be emphasizing that we're encouraging our state and Governor Abbott. I mean, he's been giving tax credits to all sorts of companies to come to Texas and open up manufacturing plants. And, he needs to add pharmaceutical companies to that list as well for the manufacture of our medications.
Yeah.
I don't know about all. I don't like pharmaceuticals. But they need to manufacture some of the things we really need for life sustaining.
Yeah.
Reasons. Like you don't have to have some medicines to sustain your life, but some you do. So.
Yeah, and we shouldn't depend on a slow boat from China to provide us our medications. So I think the second statement is kind of the heart of this plank, that we're encouraging increased manufacturing for medical and health products in the state. So are we in agreement to leave it as is for now?
Yes.
Okay. All right. So, Rick, if you can just put a little notation under these that we're approving.
Yes, thank you for the reminder. Appreciate that.
Yeah. All right. And then the next one, number 140, is labels on medications. And that's on all prescription and over-the-counter drugs and medical supplies must be required to show the country where manufactured or produced.
This would be the place that we could add labels on, vaccines that they're mRNA, whatever it is.
Yeah, the messenger RNA. Yeah, I think this could fit under the labels on medications. We could do like an A and a B.
Yeah, and maybe the title changes to
yeah,
right to know or something labeled
mean, we need to know what country our seafood's coming from. We need to know. Sorry, my dog.
I mean, basically, we want labels that have. I mean, I'm not an expert in the area, but I'm thinking if there's a substance in that, if you're buying meat, steak, there's something that's in that didn't come from the cow, you should know about it.
Yeah, like the antibiotics that were in a lot of the meat products. And we don't want messenger RNA added to our meat products.
Right.
Edible messenger RNA. Because this, labeling is a form of informed consent.
Yes.
So we could make an A item, which is the initial statement, and then add in the labeling for messenger RNA as a B item.
Yeah. And I think that'll grow over time. Meaning, I think there'll be other applications for, labeling that we're not even thinking of yet.
So we'll make the initial statement an A.
And I'm sorry, what do you want to say?
What the initial statement says is that we require labels on all prescription and over-the-counter drugs, supplements, and medical supplies to be required to show the country where manufactured or produced.
Yeah, we're basically going to change the actual 140 preamble, so to speak. We'll have a new title and a new kind of description, so that current language will go into A, and then B will be about mRNA. So I think the title that we were talking about was something regarding, right to know or informed consent labels. Anyway, I'm not claiming to be the expert. There you go. I think we have to bring it out of pharmaceuticals because it's more generic. It's more about consumers knowing whether it's a drug or an animal or that they're what's in this that may be harmful to their body.
Okay.
What if we call it informative labels on medications?
Michelle had a good idea too. I guess we're aligned with Michelle. She mentioned at 6:40 we should put it here.
Why don't you just put all labels on medications? That include all medications, not just pharmaceutical ones.
Well, and then we further define it, that we require informative labels on all prescriptions and over-the-counter drugs, supplements, and medical supplies. In addition, these products must be required to show the country where they were manufactured or produced.
In addition, how do you want that to go again?
These medical products must be required to show the country where they were manufacturing and production.
Okay. What, of manufacture and production?
Yeah, of manufacturing and production.
Okay. Is that and or production? Probably or.
I guess or, yeah, or production.
Or maybe and or, I don't know.
And this would be letter A.
Okay, so this right here is letter A, correct?
Yes.
Okay.
Yeah. Well, the entire
Tripod isn't very good.
that entire statement is A,
Okay.
starting with we require informative labels.
Oh, this is A right up here?
Yeah. Yes.
Oh, my mistake. Okay. And is this down here a continuation of that then?
Yes.
Okay.
And then B, can we go back to our resolution on the messenger RNA? I think it was back up a little bit.
Yeah, just trying to clean this up a little bit, but I'll go back to that. Sorry, where do you want me to go?
Back up to the resolution addressing the messenger RNA.
Okay. That was 138, I believe.
Vaccines. Well, yeah, I think it might have been a blank resolution listed underneath that one.
Oops. Are you talking about this one or an existing blank in yellow?
Well, that was one of them.
You want me to bring this one down to where 138, or I guess we're on 140 now?
Yeah, we're in 140.
Okay. Okay, so here's the language if you want to take some of that to make it a B blank. Is that what I'm hearing?
I think so. What do you all think? Would this be a good place for this resolution? Addressing the messenger RNA vaccines?
Is it going to be a neat plank?
The new sub bullet
Well-
to existing claim.
Because it doesn't go with labels and medications, is it? Or, I mean, on medications, labels?
Yeah, labels on all prescriptions and over-the-counter drugs.
Was there another one specifically that talked about labeling any vaccine that contained messenger RNA?
Yeah, we could just do medication/vaccines, and then have the, vaccines need to be labeled if they contain. Is that how you would say that? Or if they're, is it a design or does it contain the okay, I can never remember the order of those letters.
Yeah, it's a little M for messenger and then RNA.
RNA. Okay.
Yeah.
mRNA.
Yeah, and the little M stands for messenger.
Yes, got it. Thank you.
So we could say that we require all medications and vaccines to be labeled. if they contain messenger RNA.
Or to be labeled, yeah, that they contain it if it's, yeah, how you say that. We might,
yeah. Or we require informative labeling on all medications and vaccines which contain messenger RNA.
Yeah.
Then it kind of matches our first statement. So we'll say we require informative labeling.
I think you'd probably do it this way. We require, and then all these are their requirements.
Okay. So for B, it's going to be informative labeling on Sherry, if she's here.
Well, I think maybe I have a C.
Okay.
Anything.
So we want informative labeling on all medications and vaccines which contain messenger RNA.
Do you want messenger RNA spelled out, or is mRNA okay?
No, that's perfect.
Okay.
And then JR, you
I was
have a
just
C?
thinking, would it be helpful? Doesn't the C, like, as I understand it, the drug companies have a certain requirement to get something out of like experimental phase and to be classified as, you know, a certain threshold to be, you know, mainstream. And I'm wondering, if something hasn't met that threshold, should it be labeled experimental?
Yeah, I think C would be good because, you know, many people didn't realize that the COVID vaccine never went through the traditional trials that all other vaccines had been required to do because it was, quote, experimental.
Yeah, which contain mRNA or are experimental.
Well, and the reason I was branching it off is because mRNA is just the thing of the flavor of this year or whatever. I mean, I think anytime we're, you know, the government or any other entities trying to push something on us that hasn't met a threshold in the public trust of what is deemed, you know, like a typical drug trial that only has a certain threshold of injury that it's caused. I mean, those were some of the things that were kind of buried as it related to mRNA.
Oh, yeah.
Or whatever we put at the end after mRNA, comma, or any experimental new medications or vaccines, medications and vaccines.
Well, I was even going to say that it had not completed human trial studies.
Yeah. Yeah, that sounds good.
And how would you want to word that about human trials?
Informative labeling on all medications and vaccines.
And therapies.
Yeah, so, informative labeling on all medications and vaccines which have not completed human trial studies.
Ooh. Hey, Michelle Evans has put in the chat that we should also label products that have aborted fetal material.
Now she's speaking my language.
Yeah.
Yeah.
So this is you're kind of writing over B because
that what you wanted?
This should be C.
Okay, sorry.
Yeah. So we need to leave B as it was.
Okay.
Well,
So-
and on B we could add aborted or fetal material after the messenger RNA.
Yeah.
And you could say or are experimental, right? I mean, are
I
we
think
covering
the next P is going to address
experimental? Okay.
what is experimental.
Yeah. So for C, we'll begin it stating informative labeling on all medications and vaccines which have not completed human trial studies. and are considered experimental.
Hey, suggestion, what if we take informative labeling and add it to the one for the top? So we require informative labeling, and you can take it from all three of those bullet points.
Okay. Yeah, because that'll save us some wording.
So put informative labeling up here.
Yeah, we require.
We require.
Line down.
Sorry. Yeah, works.
I make a motion to allow the guests to clap when the community does things they like.
Yeah, do your hand clap in your
Therapeutics.
tonight.
So I don't have the end of this statement on C. Not complete human trial studies and are
Considered experimental.
okay.
And therefore considered experimental. And she gave a medical reference.
Okay, where would that go?
After experimental. Therefore considered
Experimental therapeutics, perhaps, or
considered experimental and may not be therapeutic.
Oh my gosh, that's not what it means.
Yeah, like
We could add harmful as well on there. The thing may not be therapeutic and
Still research that does have a claim, and it includes stuff about vaccines. Not labeling though. So anyway, I'm just looking at it. Okay, never mind. Cancel me. I'm going on.
okay. So therefore, and are therefore considered experimental, may be harmful, and may not be therapeutic. And
my suggestion was harmful rather than therapeutic, just to save a few words.
We take the may out before harmful.
Yeah, may be harmful.
Can't do much more, guys.
This meeting is being recorded.
medication.
Yeah, actually, you could take out an and just put a comma after experimental so that it's considered experimental, harmful, and may not be therapeutic.
That's not what therapeutics means in this context.
There we
When you take out the and after studies, I'm not supposed to speak, but grammatically that's correct.
take out the and after studies.
Human trial studies are therefore considered experimental. Yeah, just
Okay.
so which have not completed human trials are therefore considered experimental, harmful, and may not be.
Yeah. So remove that and after studies.
Is the therapeutic a different thought? I'm not grasping that. All medications and vaccines which have not completed human trial studies are.
Well, because when they're doing the studies, they're seeing one, if it's effective or therapeutic. Two, what are the adverse side effects? Is it harmful?
Okay.
So without human trial studies, you don't know if either of those are in effect.
Oh, but I think we need to, whether it's a semicolon or something, like I don't think this is 3 different things. No, I like it. I'm sorry. I'm catching up.
I think we should, instead of saying that they are harmful, we could say potentially harmful.
Yeah.
Because they may not all be harmful, but they may not be therapeutic. So just, after experimental, say potentially harmful.
Okay.
And I think, my idea behind it is there are times when people are in a place they're willing to take experimental drugs, right?
Yeah.
And we don't know or if they are or not harmful, but if they wish to take them, at least they know.
Well, down 2 more planks, we have the right to try. So, this kind of covers the right to try as well.
Therapeutics
is a noun.
We got started?
We're in the annex.
Okay. Oh, I think the idea was to put therapeutics in the list of medications, vaccines, and therapeutics.
Yeah, remove the and between medications and therapeutics.
Oh, that's actually, we wanted the and after the therapeutics. We wanted the comma before therapeutics.
Actually, the better word to say is therapies.
I literally just gave you the Lancet article. I copied and pasted it. mRNA-based therapeutics.
Cool.
So then you need to take out the last one, right? And may not be therapeutic.
Yeah, that describes an inadequacy of the medication, therapies, or vaccines. She said the Lancet calls them therapeutics.
Yeah.
Okay.
mRNA-based therapeutics.
Okay. Well, we could say all medications, therapeutics, and vaccines. Is that what you want to do?
I think
Okay.
that's
So, yeah, not there. We still have to leave that in, but we could make that therapeutics.
I just copied it because I was too lazy to type it.
no worries.
Hey,
Thanks for driving that.
no kidding. We definitely appreciate you. And therapeutic is singular, so remove the S at the very end.
Okay. Right.
Yeah.
So, do you need an and here to make it properly stated? And are therefore. So we require labeling on all medications, therapeutics, vaccines, which have not used. And are
human trial studies should be considered change it, not are, therefore, say should be considered. I mean, it's 6 and 1 half dozen. You can delete
the word which in there. You can just say all medications, therapeutics, and vaccines which have not completed human trial studies should be considered experimental, potentially harmful, and may not be therapeutic. So the which between studies and should be removed.
I'm sorry, can you say it again, please?
The word which between studies and should.
No, not that one. The other one. That one.
Okay.
Yeah. I think that sounds pretty good. Is everyone happy with accepting this plank as amended?
Yes.
Okay, everybody's happy?
yes.
Yes.
All right. Okay. So we'll make a notation that we've accepted this blank as amended. Okay, and we'll look for another spot for this resolution. So let's skip on down to our next blank, 141, which is medical records and informed consent.
Oops.
It's number 141.
It's that way. Sorry.
So this one's pretty straightforward. We oppose any state or federal medical record computer database that stores personal identifiable records on citizens without their written consent. Is that part of the HIPAA paperwork that you fill out when you go to the doctor's office, that you're consenting
Yes.
to the store, to them to electronically store all your medical information?
Right, because that's what they ask when you go to the hospitals or doctor.
And then there was a resolution kind of addressing this from the Gillespie County SD 24 wanting, I guess, additional IT security safeguards. All medical service providers, including insurance providers, must put in place and maintain a high-level technology security safeguard for consumers and patients to prevent financial losses and life-threatening delays in treatments due to breaches in one or more databases, third-party communications, simultaneous hacks, causing egregious delays and financial hardship to doctors and clinics. And, hospitals have had their records hacked. Doctors' offices have had breaches in their electronic security. So, do you all feel that this needs to be included?
I like it. The real question is, why would we not include it?
Yeah. We could make it an in addition statement, following the original statement. We could say in addition, all medical, and then include that language
Yes.
of the resolution.
So if you wanted to combine blanks, you could do something like informative labels and medical records, or informed consent on labels and medical records. Medications and medical records.
So why not leave it where it is and just get rid of resolutions submitted to go right next to 141?
Yeah, just incorporate that resolution beneath 141 into 141.
Yeah.
We could call it secure medical records and informed consent.
Yeah, that'd be a nice addition.
And then all of this up into 141?
Yes.
Okay.
And just have an introductory statement in addition, comma, all medical services, ... I like
This is
it.
a side comment. I really don't like electronic records, period. I know why they're good, but I think there's too many drawbacks to it, which they're trying to address here. We got to keep it secure. You can't keep anything that's on a computer, especially if it has a corporate link or an internet link secure. But,
Well,
I've only been doing software for 45 years, so I know you can't do it.
But this was all part of Obamacare, and it was really for data mining more than anything. So that the federal government has access to all of our data.
That is correct, and I don't like the new questionnaires they started about 5 years ago. I call it the feel-good questionnaire. It's not a medical questionnaire, it's a psychological questionnaire.
Yeah. So they can put you in a category.
Yeah.
All right, so is everybody happy with this amended version of 141?
I don't think you need to be in addition. You could just go with all as a continuation of the idea, but that's your choice.
Well, we can remove it. All right. So, is everybody happy with this amended version of 141?
Yes.
Okay. A few more voices, just so I know you're there.
Yes.
JR, are you happy?
Yes.
Man,
I was
are you happy?
I was going to add in a standards agency, but I think this is generic enough.
Okay. This will get us to next week.
Yeah.
All right, so we've accepted this as amended. All right, I will tell you that Matt sent me an email giving me a list of planks that he wants to make sure we keep, because these have become planks in the Platform Committee Promotion Committee. And 142 is one of those items that they want to move forward. So we may just want to accept it as is. We urge the Texas State Legislature and Governor to enact laws that protect patients and their doctors' rights to have access to experimental or off-label medications and procedures that can potentially be life-saving or improve quality of life without the medical board, pharmacy board, or hospital boards interfering. So this is the right to try law.
I think the slippery slope there, just as a thought though, his intent has a lot of to go into other types of categories of crime. Like, someone could easily be like, hey, yeah, we're going to experiment. Oh, look at that. Like 10 out of 10, this kills somebody late in their life.
Yeah, these, they call them orphan drugs, that sometimes they'll use in a right to try. And, the patients are totally aware of the fact that there's no guarantee that it's going to help them, and it could even make things worse. But they're in the late stages of disease and they're willing to try anything.
Yeah.
Harris County SD7 did add a statement that parents have the right to try their choice of treatment for minor children without repercussions or legal threats. And I support that, because I had, at the last convention with legislative priorities, I had a mother get up and testify that a hospital in Houston forced her child to have chemotherapy when she was adamantly against it, and they felt that they had the right to provide the treatment that they thought was best for the child, and that the mother really didn't have a say in it.
And can I just confirm that you all agree that this doesn't, we're not stating that parents can transition their child because it's their choice of treatment.
Yet another qualification, right? What they're trying.
Yeah, and I know we have that in several places, but yeah.
Yeah, just to clarify, I support right to try. I just was saying someone could have used this as well.
Well, you could add the statement with the exception of gender modification in there. That's not a right to try.
I don't think we have to mention it. I just wondered if you all, feel pretty confident we're not, saying that that's okay.
You need to mention it.
Okay. Yeah. Okay.
Yeah, we're not saying that. It's just whether somebody else would try to say that.
I mean, so Cindy, I agree with you, and I just updated a whole bunch of state affairs that has that in there that we're going to discuss either tomorrow or Friday. I mean, if people think they can actually transition their minor kid, then why can't they kill their minor kid? Right? I mean, it doesn't make sense. You don't have total control on your minor children.
Yeah, right, to harm them, but,
So, it is in there is what I'm telling you.
And I guess what I'm asking, though, too, here, now that I'm thinking about it, right to try would apply to parents. That would apply to everybody, children and parents, correct?
Correct.
It already applies to everyone without saying parents have the right. Like, why we're adding that line. And we did get a right to try passed. Is that what you mentioned? It was SB 773, but it's only stage 1. They have to have been through stage 1. So it's not comprehensive.
Hospitals will intervene on behalf of the child versus allowing parents to make a decision that they want an alternate treatment.
Okay. So this is an additional parental rights protection.
Yes.
So, Cindy, to make you feel better, do you want to put something after legal threats and say something with the exception of transitioning, surgery, or something like that, or whatever?
I don't know.
Would that make you feel better?
We're talking about it just because the word, medication is puberty blockers, but they're illegal here now. Actually illegal. The procedures are illegal. Not that people aren't doing both, but it can be.
I don't mind adding that extra emphasis, because people could look at that right to try and say, "Hey, listen, why can't I try puberty blockers?" So I wouldn't mind saying parents have the right to try their choice of treatment for minor children without repercussions or legal threats, except for gender modification.
And murder.
I know. I'm thinking somebody who decides their child is too much trouble.
Or just
I think there has to be some kind of from a physician standpoint, that this is indeed a terminal patient or a patient on some kind of life-saving care, that this is actually a treatment that has some chance of saving, not just, I lost another patient. I guess that experimental treatment that seems to 100% kill people guess it didn't work again.
Okay, so somebody just popped up a chat, which is an interesting point. I kind of like that too. Do y'all see the chat that just came out? So, for minor children, you can't just have one exception, which is gender modification. There's a lot of other things. You can have a parent think that they don't like that person's right arm and cut it off, right? But if you put something in there that is, I like that, consistent with the platform of the state party, or the principles in the state party platform.
Consistent with our state principle.
And it's all over the place about that.
Yeah, that protects a lot of.
Yeah, I like that. Whoever popped that up, that's a pretty good suggestion, because that covers a lot of stuff.
Parents to the right to try their choice of treatment for minor children consistent with the RPT platform stated principles without repercussions. Yeah, I mean, that covers it. And
Yeah, you can't pump your kids on marijuana treatment or something like that, right?
Yeah.
I mean, there are principles that are fixed in the platform that says we don't agree with.
Yeah, I think that's nice.
That was a good point. Whoever brought that up.
Yeah, that way we're not sending mixed messages.
Thanks, Amy. You can't really testify, but chat. I don't think that's accepted. I'm not sure.
It's not really happening. You don't. Really
No, I don't know what you're talking about.
Yeah, they can chat according to the rules by Matt.
They can?
Yeah.
Okay.
Good.
Yeah. I mean,
Yeah,
I'm
they just can't
happy
speak.
they're here. I mean, I appreciate their input.
Absolutely.
So, all right. So
I mean, in reality, when next week there'll be sidebar chat, then people.
Yeah. And, and this is one of the.
Way,
Yeah. And this is one of the priority planks. So, they'll go over this and, they'll make their final version of it if they're not happy with it.
Now, I move we adopt it as set up now.
Second.
We can move on.
Okay. All right. When we're all in favor, so we'll move on. Okay. All right. Very good. So we have completed our category on healthcare independence, and now we're moving to government-funded healthcare programs. And the first one on the list is number 145, blank 145.
I'm sorry, did we do anything with 143 and 144?
Oh. I'm sorry. We skipped 143 and 144. I'm sorry. Okay.
I missed it, sorry.
Because that wasn't Matt's platform that passed. 144.
Yeah, I'm sorry. We've got to do 143 next. So this is the healthcare savings account. All individuals shall be allowed to establish health savings accounts. Individuals shall be allowed higher annual contributions to health savings account.
Ambiguous.
Who determines if individuals are allowed to have higher annual contributions to health savings account?
I know the company they work with. I know we had it for Harris County. We had that.
Yeah. The company enforces it, but it's the government can only give so much to an HSA.
The government won't let us put any in our company's thing because we own the company. So we can't do it. And like I, as a volunteer and stay-home mom, full-time volunteer.
The IRS.
I can't set one up.
It's the IRS sets it, and it's currently 2024 limited to 4150 for self coverage, 8300 for family coverage.
And we're not allowed. Period. So even though we provide them to our employees, I think it's a good statement in there that we should all be able to have one if it's allowed. To help.
Yeah, if it's allowed.
And cover your expenses. Then.
So, just to speak to this a second, all individuals shall be allowed to establish health savings accounts I believe this has to do with the, in order to have an HSA, you have to have a high deductible plan currently. So I think it would basically say, take that requirement away of having a high deductible plan, and then allowing you to contribute as much as you want to an HSA. Well, the second statement is a little ambiguous because, okay, what's higher? Is that 41.55? You know, I mean, should it be a percent
Allow
of?
unlimited?
I was going to say maximum should be allowed, the maximum annual contributions, like the maximum allowed for annual contributions.
And I know in Harris County they allow you to do that, but if you don't use it, you lose it.
Yeah, you got to make sure.
Different. Isn't that the prepay? I mean, the one where you're actually using a debit card to pay for stuff and you've set money aside. I think that's different. This is the one that you can let build kind of like an IRA. And if
Right.
you end up needing a whole lot of health care, say you save and save and save, and you have to go into memory care someday, you know, you could have several years of memory care. It's sort of self-insurance for the things that it's hard to get insurance for, or big expenses with a hard policy.
It's also not taxed, I believe.
Right. And then there are rules about if you have money left in it, you know, what happens to that money. So that would probably make people not put too much in there, you know, more than they think they'd need. But
Are y'all happy with just leaving it as is then?
Leave it as it is.
yeah.
Okay. All right. So we'll approve this without any changes. All right. Now we go to 144, Texas HSA, and this is another priority plank.
That passed. That puts on Matt's planks that passed. He has that one on there.
Yeah. The 145?
Yeah, no, 144.
144?
What do you mean by pass?
Well, he has a number. He submitted to his a spreadsheet with all the planks that passed. But that one on 144, he has it on there, but it doesn't state the same as what it's showing on here. So I don't know why he has 144 on there. Because on his, it's 144 is gender ID, and that has nothing to do with this at all.
So the 144 right there, that's in yellow, is the existing one, I believe. And
Yes.
I'm just saying the next one is my SD. We passed that. I'm just messing. Texas HSA would recommend the creation of the state of Texas health savings account with funds in excess of the needed. I mean, it's substantially the same. They just added funds in the Texas HSA shall not expire, nor be utilized for any other purpose, which it's all good stuff.
Yeah. I mean, I'm happy with the SD7 amendments
That sounds good.
that we could add into it.
I'm partial.
So
Just
Rick,
like,
you want?
I'm admitted my bias, so.
So, tell me what you want included then?
Yeah. So we'll just include those grammatical changes that SD7 recommended into the original plank.
It's like watching your kids play football. It's like,
Eliminating planks, but if we start getting called out, I thought we could combine 149 with this one and make it one plank, because they're both about, you know, solving Medicaid, although this includes pulling out was one of the areas we could do that.
That's a good idea.
Oh, and Harris County SD7, is that you? Yeah. They've actually kind of combined that until we establish the Texas HSA. So they're referring back to it, which also tells me we could combine them pretty easily.
So I think the intent is that the Texas HSA would replace so I see we have people coming, and I think the intent is to transition funds away from Medicaid to the Texas HSA. So it's not to leave people in need.
It's to help them help themselves or something.
Well, no, I think if we were to just eliminate Medicaid, the concern would be that certain people wouldn't have assistance. So I think the heart of this is the transition away from Medicaid being more of a federally, having federal oversight versus the Texas HSA being more at least state controlled.
Right, and we'll have to fund it ourselves because unless we get block grants with no rules, then we fund it ourselves. And we're saying in the previous one is that we'll fund it with rainy day funds that are excess of what we need in there, because we'd have to fund it, and so calling on block grants is a way to fund it. Okay, here's another one.
And I will say that this plank 144 is one of Matt's priority planks that he wants us to keep, and so I don't want to change it too much because it's kind of he's listed as a priority the way it was. I think the little bit of grammatical changes we made are okay, but I don't think we should add too much to it right now.
We'll tell him it's his fault we're not getting rid of a plank.
Yeah, yeah. We'll try to find. We'll find one plank we can at least get rid of. All right. So is everyone okay with accepting 144 as amended?
Yes.
Yes.
Yeah.
Yes. Okay. All right. Let's do that. All right. Now we move to government-funded health programs. So the first one, 145, parental safeguard. We support abolishing the Texas Child Mental Health Care Consortium, the trauma-informed care policy, school-based mental health providers, school-based or school-connected mental health interventions, and other public school programs that serve to expand access to minors. Legislators shall prohibit all reproductive health care services in public schools. I agree with all of that.
Yes.
Okay, I wrote language for that, and now I can't find it.
Let's see. SD7 had one grammatical change.
Shoot.
That we can add.
Here it is. Okay, here's what I thought with that. With C, that not everybody liked in medical freedom, we could instead put it here. Okay, I'm sorry, I've got all this stuff open trying to put this together.
I can, you want me to read C real quick?
No, I don't need that. Okay, so parental safeguard, because we're talking about this, what they're doing. Okay, hold on. I've got two places. You go ahead. I'm going to try to find which two places I'm talking about here, because it could be, I thought we could change 145 to say preserving parental rights, because this is an issue we work really hard, is against this mental health consortium.
Right, and on that Freedom Health thing on C, it had to do with parental safeguard, parental.
Yeah.
We discussed that.
Yeah.
They're both, parental rights in an area, safeguarding our rights. So
Yeah.
parental rights could, in mental and, whatever health, but we could add to that, any, like the next
Yeah.
the withholding of, that you also, we support abolishing this consortium, and we prohibit the withholding of any information relevant to the physical or mental health of a parent or legal guardian's minor child, including information related to a minor's perception that his or her gender is inconsistent with his or her biological sex by any public or private school employee or any healthcare provider. And I don't know if we have to say employee or if it's just any public or private school. That's what's in there now. It's just public school. A public school can't do this. I don't know if
Yeah, because it's already in there, so I would leave it out.
Okay, so leave the word employee out. Okay,
Yeah.
Okay.
C does refer to parental safeguards, primarily because it's addressing any attempt to withhold information from the parents about this mental health care that's being provided.
And
So,
I was for leaving it in, but we just seemed to have a lot of people who wanted to take it out. So I did this work in preparation that I got voted down, and we took it out of healthcare independence. If we took it out of there, then I want it moved somewhere in our section. No matter the fact that we mention transgender stuff other places, we don't mention keeping information that your kid's interested in this subject, from parents. And we've got to keep that in our platform.
well, I'm definitely against any healthcare provider withholding information from the parents or legal guardians. And we could make this plank a two-part, where the initial statement is A, and then we bring C in as B, as part B.
C has a lot of stuff that this plank 145 has a lot what C has. The only thing that it states that's different is about her gender or sex is inconsistent with his or her biological sex. About that's the last sentence in C is the only difference on 145 to be added on here.
Yeah.
Well,
Because everything else is already on there. The only thing different on 145, it doesn't state anything about that, but I think where it says reproductive health care services pertains to that.
Maybe. If you guys are all good with leaving it, we'll leave it there. And so I was just trying to find a place that could go.
Well, I'm happy leaving it there because
Yeah, okay.
137 is one of Matt's priority planks.
Yes.
So we should probably just leave it as is.
Okay, thank you.
And let them address any additional changes. I mean, we made a few little changes, and then the committee next week may make some additional ones, but we probably shouldn't mess with 137 too much.
Okay. And so back to 145 then, I would add the word any other, not just other public school programs, include all of them by saying any other public school program. It's Harris County again, SB7. That's a good word to add. This came in with SB 1011, that kind of fiasco. It's totally a pharmaceutical program, and it gets more kids on pharmaceuticals, but trauma-informed care says, oh, you've had a hard life, so we're not going to hold you responsible for anything. It has to do with discipline problems in the school, all kinds of things. So anyway, we want it gone, and I think we should add the word any in the before other public school programs, as recommended by. I move. We add the word any as recommended in the submission right below the blank.
All right. So are we in agreement then to accept this blank as amended?
Yes.
All right.
Looks good.
Okay. All right. Next, we'll move to 146, welfare reform, and this is another one of Matt's priority planks.
My only comment looking at that in advance was that we could move D into C and make it shorter. If we say C, subsection C, reforming welfare programs to require recipients to remain substance abuse free, and willing to submit to and pass random drug testing in exchange for temporary benefits not exceeding 2 years. Then D and C are combined and it looks shorter. Because they're somewhat similar.
Yeah. Oh, yeah. You could definitely combine those two. Because they have to, they've got to submit to the drug testing to confirm they're substance free.
Yeah, I think they could go together. Let me see if I can do a copy of this. If I can. Who's doing the typing for us?
I think, Rick, are you still?
That's Rick. Yeah, I'm still doing it.
Okay.
He decided it was going to be too disruptive to try and change in the middle.
Yeah. Okay. So if I send it to 2024 RPT Convention, that goes to you? No, 2024. 2024.
Well, I'm sorry, what are you asking?
Can I just email you the word change? Or
You can text it to me. You got my personal information, don't you?
Yeah, but I don't have it. I can take a picture of it.
That's fine. I can work with that.
Okay.
Whatever's easier for you.
God, get pop-ups. We can just read it.
Okay. So where are you talking? Where are you inserting?
Okay. So under remain substance abuse free, and this is what you're adding, and willing to submit to and pass random drug testing.
Got it.
And then you're back in exchange for temporary benefits.
Yeah, I put that in.
Okay. Oh, sorry, I was looking at my screen.
That's okay.
Okay.
And then we would
strike
out,
D. Yeah, we'd strike through that D.
And we don't change the meaning of anything. We just don't say benefits twice.
We're submitting
I like that comment that just popped up again.
After 2 years.
Yeah, what happens after 2 years? They turn around and get their benefits even though they're doping still?
Well, C is saying we want to limit benefits to 2 years. I mean, we got to get all this passed.
Yeah, I think they're reassessed after 2 years.
Okay.
This is saying random drug testing, so we should be able to call anybody in who's getting checks from the government, for this kind of welfare at any time.
Yeah, I like it. Not exceeding 2 years, just remove all of that and leave benefits, period. You want benefits? Get drug tests and say drug free.
Yes.
If it was up to me.
Other people's money. And so, we don't want you using drug money.
So does that mean taking out the word temporary then?
Well, we
You want benefits?
Yeah, I think they're emphasizing temporary benefits.
For you new people? My connection
not
has been
Now, they
crap.
get rid of temporary. They just say
But if you go to the
benefit.
convention,
Okay,
texasgop.org
what
committees
we could
page.
to assist.
So
Yeah.
if you go to
To
the committees
temporarily
and
assist
scroll
individuals.
down all the way,
To put it before us.
you can
yeah.
see these pre-convention
And then you could get rid
meetings.
of,
You can click on them and go directly to
the
the
last
Zoom
one.
meeting, and you don't have to mess with my connection. We just aren't finding
And
any
you don't even have to. You don't have to have any
recording
you don't have
of
to have
these
any
Zoom
exchange
meetings
temporary benefits,
for delegates
not exceeding 4
to
years,
review.
right?
So
Just
I'm
a
streaming
period.
it.